Hello, today I'll talk on lipoprotein A. It's a small molecule like an LDL cholesterol, which we commonly call bad cholesterol. Apart from it, it has another molecule called apolipoprotein, and hence the name is lipoprotein A. It is a known risk factors for causation of heart disease, stroke. Therefore, nowadays I especially recommend to go for lipoprotein A. Measurements of lipoprotein A. If the level in your blood is very high, then we have to be very cautious about the future incidence of ischemic heart disease and stroke. In fact, I have seen a lot of young patients whom I did angioplasty. The lipoprotein A is very high. So it was not so known factors even few years ago. And after that, even we did not have any test to measure it, but fortunately we now have all these things so that we can measure the lipoprotein A in your blood. And I recommend to go for lipoprotein A in regular intervals in those patients who have a significant family history, or those who underwent angioplasty, or those who have significant burden of such atherosclerotic heart disease. So the main responsible factors is basically genetics. Apart from that, there are some other conditions like kidney disease, hypothyroidism that may also affect the levels. In some ethnic individuals, there may be the average blood levels may be high. But if the level is very high, then you should be cautious about such future outcomes. Unfortunately, we do not have any clear-cut molecule which can lower the lipoprotein A. Recently, there are some studies regarding some molecules, but it is still not in the market. The commonly used statins for lowering cholesterol is not so effective. Regarding PCSK9 inhibitors, a very new molecule which may lower lipoprotein A, but the data is not robust. Lifestyle modifications, diet factor is definitely important, but we do not know how significantly it can lower down a lipoprotein A. So the important factor is to monitoring and to discuss with your doctors regarding how you can go ahead with high level of lipoprotein A. And of course, you have to go for other tests to look for other risk markers so that we can lower down the future possibilities of having ischemic heart disease. I hope it clears some of the doubt regarding lipoprotein A, because nowadays we are getting a lot of young patients with high lipoprotein A, and that is really alarming. Thank you very much.